Are you new to the NICU and are confused about feeding tubes and donor milk? In this video, I will explain to you what feeding looks like at the beginning stages of the NICU. Stay tuned. Hi there, my name is Iman, and on this channel I teach moms and their families all about their high-risk pregnancy and the NICU to decrease fear and increase confidence. In this video, I will explain the basics that you need to know about feeding when you are new to the NICU. And make sure you stay till the end of this video because I have a free printable for you that will help you with your NICU journey. So when a baby first comes to the NICU, all babies, premature or full term, will have a feeding tube. And this is because with premature babies, obviously we know that their brain is not developed and they probably won't be feeding by mouth anytime soon. But for full-term babies, the reason why we put a feeding tube in is because they are in the NICU for a certain medical reason and we don't know how well they're gonna feed by mouth. For basically, I would say 90% of the babies that go to NICU would have a feeding tube inserted from the beginning. So there are two types of feeding tubes. You have the OG and you have the NG. The OG, which is the orogastric tube, it goes through the mouth down to the stomach. The NG, which is the nasogastric tube, goes through the nose down to the stomach. So one tube is in the mouth and then one tube is in the nose. So a baby will get one or the other. So babies that would get an OG versus the NG depends on many factors. But the most common factor is the type of breathing support the baby is on. So most babies that are born really small, that are intubated or have CPAP will always have an OG, the one that goes through the mouth. But the babies that are bigger, more stable, that are either have a bit of nasal prongs or they're breathing on room air, meaning they're breathing on their own, those babies usually have an NG, the one that goes through the nose. And so usually babies start off with an OG because they need more breathing support. And then once their breathing is more stabilized, they switch to an NG. And we eventually want all of our babies to switch from an OG to an NG because that would help avoid anything being in the mouth that would interfere with learning how to feed by mouth. So we don't want anything in the mouth when the baby is learning how to feed, ideally. There are different sizes of the OG and the NG depending on how big the baby is, because obviously you don't want to stick a big feeding tube in a very small baby's mouth. So if the baby is very small, they will get the smallest size. And if the baby is born full term and they still need an OG, then they will get the largest size OG. But just so you know, there are different sizes of feeding tubes. So you are probably wondering, how do nurses know how far to insert the feeding tube? Before we insert a feeding tube, we always measure. And there's a little process we always use in the NICU. And the measurement, I'll actually insert a photo right here. The way we measure is nose, ear, and down midway between the xiphoid and the umbilicus. And I'll insert a photo here to show you how that looks like. And so inserting a feeding tube is uncomfortable for our babies, obviously, because if anything is going down your nose or your mouth, obviously you'll have the gag reflex and it's just very uncomfortable. So when we are about to insert a feeding tube, we get our babies contained. If it's going in the nose, we get the babies to start sucking if they're older. But we always try to get them comfortable, contained, even bundled, and get their arms in, just to make the process a little bit less uncomfortable. But it is uncomfortable. So we try to do it as fast as we can. And the other thing is we always try to tape the feeding tubes down really well so the baby doesn't get at it and to avoid reinsertion. Comment down below if you have seen a feeding tube being inserted in your baby. So what does feeding look like? So at the beginning in the NICU, if your baby is really small, I would say under 32 weeks, they will usually start off with an IV and they would have a feeding tube put in right away. So at this point, the feeding tube will be used to feed your baby just until your baby can start to learn how to suck on a soother and starts learning how to suck, swallow, and breathe to eventually take a bottle. But until then, the feeding tube will be used. So your job, moms and dads, is to help your baby learn how to suck the soother. If your baby is interested, if they're awake, if they're sucking on their hands, if they're smacking their lips, That means they are ready to start sucking and practicing the soother. And whenever your baby's awake, offer them the soother so they can start practicing. And as they get better at sucking on a dry soother, then they can be transitioned to maybe getting a little bit of milk in their mouth and maybe offered a bottle. But the beginning stages is always offering a dry soother and getting them to learn how to suck. These are for babies that are born under 32 weeks. For babies that are born after 32 weeks, depending on their state and how big they are and how they are doing. So these babies will usually have only a feeding tube and no IV. And usually they would have an NG. Some of these older babies might have an IV if they have, for example, a blood sugar problem or if they're getting antibiotics. So these babies can be offered the bottle or breast first before we use the feeding tube. The reason why they have a feeding tube is because we don't know how well they're gonna feed. So we always feed these older babies by mouth first, either by breast or by bottle. Then we put the rest of the milk down the feeding tube if they haven't finished their bottle. So the type of milk your baby will be getting is firstly breast milk. So we always tell our NICU moms to pump right away. Pump right away and pump often. At the beginning, moms, you'll be getting drops to like maybe 5 mils. And that is so normal to get very little at the beginning. But just keep at it and bring whatever breast milk you get to your baby because it will be used. Until then, the option we use is something called donor milk. So donor milk is an option we use for babies that are under 34 weeks, or some babies that are born over 34 weeks might get the option of donor milk if they have other medical concerns. But donor milk is usually for babies that are born very small. When moms that are healthy and breastfeeding have excess amount of breast milk and they donate their breast milk for sick babies to use. So these moms go through many interviews, they go through many blood work, and only healthy mom's milk is used. So once that milk is received from the approved donors, that milk is pasteurized in a lab. Then once it's screened and it's all cleaned and it's been pasteurized, that milk is packed up and dispensed all across the country for sick babies to use. And donor milk is the second best option after mom's breast milk because it's still breast milk and it still contains all that life-saving nutrition that premature babies need. It's definitely a better option than formula. The thing about donor milk is consent is needed. You need to sign forms if you're okay for your baby to get donor milk. Donor milk is only a bridge for your baby, meaning it's only used until your breast milk comes in. So it's only used at the beginning, and then once you start getting more breast milk for your baby, then it will be stopped. So it's only a bridge. So important for parents, especially moms, to understand this, that it will not replace your milk. Just a bridge to help you increase your supply, and once you are making more milk, then the donor milk will be stopped. The other thing about donor milk is that because it's breast milk, it's so much easier for our babies to digest, especially our extremely premature babies to digest. And there's so much less problems when it comes to their stomach and their gut when we use donor milk versus formula. And like I said, in my hospital, babies that are born under 34 weeks automatically qualify if parents consent to it. So just double check with your hospital of what the cutoff is of a baby receiving donor milk or not. So if your baby is born after 34 weeks, then they won't qualify for donor milk. So their option is breast milk or formula. So mom, if your baby is born after 34 weeks and you don't want them to get any formula, make sure you communicate this with your medical team and they will work with you on how you want to feed your baby. So you can definitely deny formula if you are in the NICU, if you want. Therefore, if you deny formula, that means you'll be exclusively breastfeeding and you'll be at the NICU a lot more often. So just talk with your bedside nurse about your feeding options. Okay, so I hope this video helped you understand and gave you a better picture of what feeding looks like at the beginning stages of your NICU. And to help you even further, I have a free printable for you that contains all the common medical terms that are used in the NICU. And I know you probably have heard many of these terms and you have no idea what it means. So I created this whole cheat sheet for parents that contain all these medical terms that you can refer back to. And if you're interested in grabbing that, make sure you check the description box down below.